And we will officially launch. Good afternoon, everyone, and welcome to a very special open classroom. I'm Janet Gillow, Director of Professional Development for the Brown School, and I'm joined as moderator by Laura Peer, who's Training Programs Manager for ICHAD and Smart Africa. Throughout this presentation, you are muted, and the session is being recorded. However, please do feel free to use the chat function to say hello, to post your comments and your questions. I want to take a second to invite you to an upcoming program. This Thursday evening, we're delighted to be partnering with Homegrown St. Louis and the Violence Prevention Commission to host a town hall. It's going to gather community feedback about the St. Louis Metro Police Department's collective bargaining agreement. So we're excited to be partnering with great organizations to do that, and that's Thursday evening at 6 p.m. Please register on our website. But today's program, I'm super excited about to be co-sponsoring with ICHAD and Smart Africa. It's also an opportunity for the Brown School to be highlighting one of our very distinguished alums. And to kick us off today, it's my great pleasure to introduce our own Dr. Fred.
Okay, thank you so much, Janet. First of all, I have to say that I know Dr. Charita Castro as a friend, but she's a classmate, a friend, put together, she's a colleague and all that. So, and I've really witnessed her grow through the ladders, but it's not my role really to introduce her. So what I'm going to do is first of all to tell you about what ICHAD is and what we do. So we are very excited. So at ICHAD, we focus on, our research is focused on child health and development. We also have several projects around mental health. And we started this speaker series about coming to 3 years now ago. And we highlight work of faculty, highlight work of our community partners, our stakeholders, and then now our alums. So it's an exciting forum for us to be able to share. So, and we are very thrilled today to be partnering with our Open Classroom to ensure that even during COVID-19, that we can continue with this tradition, which has been very, very well received. So thank you so much, Janet and Open Classroom, for giving us the opportunity. So having said that, so I have the great honor to definitely introduce my Dean, Dean Mary, who will be able to introduce a colleague of mine and a friend, like I said at the beginning, Dr. Charita Castro, whose impact is so impressive and very far-reaching that may be prayed by myself. I cannot introduce her, but she deserves a dean to be introduced. So thank you, Dean Mary, for accepting to introduce Dr. Charita, and over to you now. Thanks, Dean Mary.
Beautiful. So thanks, Dr. Fred. And so I just want to elevate for just a minute the platform that ICHAD, our shared center, Smart Africa, has created to really elevate new important work for children, their families, communities on the continent of Africa. And so Fred, your leadership has been so important. We're grateful, Laura, for you and the support that you and leadership that you provide for our training programs. This work is really, really important, and I'm glad that you're putting it on a platform like Open Classrooms. I also do want to mention that it's Dr. Fred's birthday. He doesn't always wear to the Open Classroom webinars, but it's wonderful to celebrate, Fred, your special day, as well as Janet Gillow's birthday is today. So please extend in the chat some birthday wishes for our colleagues. So with that, it's really my pleasure to introduce Dr. Castro. And I have gotten to know you over the years as well, not as a classmate, but as a distinguished alum of the Brown School and a champion of actually the next generation of change makers that are currently in school. And so, I could, Charita, you should know that I have like of your accomplishments. And so I'm not going to read them all, but I am going to read things because I think that you're an amazing role model for our profession. And so your bio actually starts with data can change the world. That's what if then Ambassador Charita L. Castro believes. You're an alum of the Brown School. I'm not going to say what year you graduated. It wasn't that long ago. 18, you received the Brown School Award of Distinction. You have played a central role helping to elevate women in science, in research. And there's been so much that you've done from your government platforms, from your NGO platforms. And I have to say that I look at what you've done, particularly around child labor and human trafficking, and I am completely inspired by you. So I'm glad you've taken a new position recently. You were the Director for Labor Affairs at the United States Trade Representative in the Executive Office of the President. And what's really important about that, Charita, is that you are in the game. You're in the policy game. You're embedded in at a complex time in our policy agenda that is really supposed to center fairness for children and families and communities. And I am so appreciative of your leadership. So I'll be glad to post some additional things about your qualifications, but also to just say you're one of the finest human beings that I've had the pleasure. So thank you so much for talking to us today. Yeah.
Thank you so much. Thank you. So should I just jump in? Oh, I think you're muted, Mary.
You could definitely jump in. So do you sharing your screen? Are you okay?
Okay, I will start sharing my screen.
Beautiful.
Okay, I just need a little bit to get it started here. Okay, can you see? Is this working? Okay, well, good afternoon. Good afternoon. I am joining you from Washington, D.C. Thank you so much, Dean McKay, for the warm welcome. And I think you all know by now that when Fred calls, whether it's Dr. Fred or Dr. Mary, I'm so glad to be in community with you all. I'm super happy and grateful to be the inaugural speaker of the 2020 ICHAD and Smart Africa series. For all that the Brown School has given to me over the last 20 years, I remain forever grateful. So truthfully, as we all take the health precautions we can by distancing ourselves physically, I take great comfort in being with you today, and I hope that you and your loved ones are safe and healthy. Before I continue, I hear it's a birthday, so I have to do my own shout out to Dr. Fred and others. I hope when we're done with this lecture today, you will listen to Stevie Wonder's Happy Birthday. Now, to say that 2020 has been a difficult year is an understatement. This year has unmasked what is broken in our world. You hardly need me to deliver the roll call of concern. The pandemic, the challenging of balancing the needs of our planet with the needs of the poorest who live on it without opportunity, and the bigotry that tears away the lives of Black women and Black men and Black children. But it has also revealed what is beautiful, and that is the beauty that is not only beyond circumstance and suffering, it is revealed by circumstance and suffering. That beauty is the spirit of people who offer their gifts of service to help others, and that would be you, my friends. And they do it, you do it, not because government or guilt. You do it because that's the right thing to do. We take care of each other, and that is who you are, and that is who we all should be. So at the outset of COVID, my fellow AAAS IFTHN ambassador, Katrina Popovich, she's an engineering freshman at Cornell, used her skills of 3D printing to fill the gap of PPE that frontline workers needed. Some recipients were my own family members who were nurses in the emergency room. So if you ask me what is beautiful, that is beautiful. And that's one reason that in these times, I can find joy. The actions we take form a legacy, whether or not we intend it. What we do matters. Our outlook matters, especially in hard times. And that brings me to today's spotlight, Grace Abbott, a Republican woman, American social worker from the Great Plains of Nebraska, born in the 1800s. And I should share, this is the first time I am doing this presentation, especially for the Brown School. We are here because of her. So I'd like to tell you about Grace, her remarkable life, and the example she sets for me, for you, and for anyone who wants to create more joy, more softness in a very hard world. Okay, so for today's open classroom, I hope you learn about the impact Grace Abbott had on our social work profession, understand the importance of having a multidisciplinary mindset, whether that's understanding the full social, economic, and political dimensions, how they are playing out in your countries and around the world, introduce you to practical tools to tackle child labor, especially the U.S. Department of Labor's Sweat and Toil app that I hope you all have downloaded, and invite all of you to take up the call to end child labor. I'm going to try to do this all in like 20 minutes, so let's see how this goes. Grace, who is Grace Abbott? Grace, along with her sister Edith and the many women at Hull House, were pioneers in creating the field and professional standards of social work. And I have Professor Michael Charita to thank for introducing me to these social work pioneers who led me down the rabbit hole of child labor. So Grace, she's not well known, you know, I mean, you have to dig for her, you know, we don't always know about her, but she's most known for being the first director of the Child Labor Division of the U.S. Children's Bureau in 1917 and served as the chief of the U.S. Children's Bureau from 1921 to 1934. While the director of the Child Labor Division, she was in charge of implementing the Keating-Owen Child Labor Act of 1916, which was the first federal child labor law. Government documents indicate that the act banned the sale of products from any factory, shop, or cannery that employed children under the age of 14. And we can talk more and more about the Keating-Owen Act, but that's besides the point for this day. The Supreme Court would later rule that this act was unconstitutional, but Grace would go on to fight on behalf of children. Some of you, as Dean Mary said, may know that I spent a little time, about 20 years, as the chief of the Research and Policy Division at the U.S. Department's Office of Child Labor, Forced Labor, and Human Trafficking. As she mentioned today, I work for the U.S. Trade Representative as Director for Labor Affairs. So let's see, a social worker doing trade. Have no fear. In fact, I think I'm following the path blazed by Grace Abbott. In this case, beginning by understanding all the policies and the problems that contribute to the elimination of child labor, and seeing if we could bring this mission to more places by tying it to trade. In other words, we start by doing the right thing, then we look for more ways to make the work go further, to spread it around. Okay, back to Grace. She was born November 17, 1878 in Grand Island, Nebraska. Her father was a lawyer and her mother was a teacher. For play, she liked to watch her father argue cases at the courthouse. I also learned through reading about Grace that her mother would share with her how they were on stolen land from the Native Americans. Of course, it would be impossible to go over the entire life of Grace, so I leave you with the Grace Abbott reader, but I did pick out some highlights I found interesting and most relevant to our talk. One of the things that caught my eye was Susan B. Anthony, a suffragist, was pivotal in the women's fight to vote movement, which we're celebrating today, was a house guest. Could you imagine being a young child and watching Susan B. Anthony? But as you look at Grace's career, what I want you to take away is that she laid the groundwork for children's work internationally, including conventions against child labor at the International Labor Organization and the establishment of the United Nations UNICEF program. I wish I could see your hands. I would want to know how many of you knew about this. To put it mildly, here's a letter to Grace written in 1934 from President Franklin Roosevelt. He writes, "My dear Grace, as you have rendered service of inestimable value to the children and mother and fathers of the country, as well as to the federal and state governments, I have long followed your work and been in healthy accord with the policy and plans you've discovered." Okay, so let's also hear from the woman. The first woman to hold a cabinet position, Frances Perkins, US Secretary of Labor, said, "Grace was one of the greatest women we have ever produced in the United States of America." She goes on to talk about Grace being great because she had knowledge and knew how to bring both her heart and brain to the work she was doing, and she was a learner until the end of her life. So why learn about Grace now? Why, for an ICHAD and Smart Africa series, am I teaching you or sharing with you the stories about Grace? Well, let's hear from Grace herself. Grace Abbott. "I think people believe very often I am impatient, but impatience is necessary where children are concerned. If you postpone assistance until a more convenient time, you postpone it indefinitely as far as that child is concerned." I say that we are carrying on her work even today. And like you, I know that you all share this impatience when it comes to children. So I want to take a moment to tell you where we stand today. Child labor is not a thing of the past. It is very much present today. It's in the food we eat, the clothes we wear, and the electronics we use. The ILO estimated in 2016 that there are 152 million child laborers around the world. This includes children in forced and bonded labor and slave-like conditions, including armed conflict, prostitution or pornography, children used for illicit activities such as drug trafficking, and found in very hazardous situations. Domestic service that prevents girls from going to school, and in agriculture, where 70% of the world's child labor is where 70% of the world's child labor, and children are exposed to heavy loads, dangerous tools, and pesticides. If you all have been following the story over the last 15 years and recently in the Washington Post article, there are 2 million child laborers involved in cocoa production concentrated in 2 countries in West Africa. For those of you who buy certified products, especially chocolate, ask them what they do to ensure that their supply chains are free from child labor. So this year marked the 20th anniversary of ILO Convention 182 on the worst forms of child labor. This convention has seen 2 historic firsts. In 1999, it became the first convention unanimously adopted at the conference. This was also, I came to know about this because I was doing my doctoral program and learned about this convention, which has led me down a rabbit hole of child labor. Nearly 20 years later, every single member of the ILO, 187 countries, have ratified the convention, making it the first ILO convention ratified by every country. Every country in the world has now called for the urgent elimination of child labor and has committed to take action against it. In 2017, the elimination of child labor by 2025 was included as one of the targets in the United Nations Sustainable Development Goals. With an international framework and unanimous consent for all countries, the elimination of child labor is truly now a global concern. So since the ILO first started measuring child labor in 1995, which is not here on the screen, this shows back to 2000, there's been a 38% decline in its prevalence from 250 million to 152 million over the last 25 years. So in case these points get lost in these numbers, I'll say it plain. We are making progress. Are we making enough progress? Never enough, never. But the curve is turning down. That means children are being withdrawn from work, some very dangerous work, so that they can have childhoods and go to school. At the same time, Sub-Saharan Africa accounts for 47% of child laborers, with the greatest proportion of child laborers relative to the child population. That's 72.1 child laborers in Africa alone. The onset of COVID threatens to erase these gains or even increase child labor where it's already high. If we are to eliminate the worst forms of child labor, we need professionals like you, professionals working in ICHAD and the SMART initiative, working on children's issues to help tackle the problem. Which brings me back to Grace. The historians Judith Sealander and John Sorensen said she was a true believer, convinced that government action could solve problems, not worsen them. Someone who was well-trained and scientifically minded, and who, as a public servant, could bring change to society. I'd like us to learn about what tools of the trade she possessed. She left us a playbook specifically for the social work profession. Grace assembled a 2-part volume of The Child and the State, over 1,000 pages, laying out what a social contract could look like between the government and the child. In it, she discusses how she and others went about leading the fight to protect children, including ending child labor in the United States and internationally. She talks about providing universal health care to children. She too was called a socialist back then. So we must do what she did, and we must know what she knew. And she knew how government worked, the executive, legislative, and judicial branches. She knew social legislation. She knew how to analyze it and how to draft it. And most of all, she knew what it took to get it passed into law. She worked with politicians from both sides of the aisle. There's a lesson for us today. Grace was an administrator too. She understood the funding and management needed to translate policy and programs on the ground. She was a good manager. She could get others to produce excellent work in great volumes. And she had a tough skin. She didn't take things personally. It was never about her. It was always, always about the people she lived to help. That is something that I am still learning. And in exercising all those skills, she brought historic integrity in her work. She had to, because she was the first. The first one through sets the tone for everyone that follows, and she was acutely aware of that. I'm gonna leave you another song in the words of Latrix, Lady Don't Take No. She was a woman of profound intellect and boundless imagination. Dr. Fred, I hope you, oh no, yeah, I hope this one's for Janet. Janet, I hope you listen to this song. Do a birthday dance afterwards on this one. And I'm sure how I've just described Grace and other words have described Grace, that she reminds you of a hero we just lost, Supreme Court Justice Ruth Bader Ginsburg. Okay, so in my last part, I want to share another quote from Grace. And one of the things that I want to share is how would Grace end child labor in Sub-Saharan Africa? What would be her thoughts? What would be her advice to us? So here's one of her quotes. The Children's Bureau does not want to print reports which the social historian might read some 100 years from now and say the investigation was well made and the recommendations valuable. And it was too bad nobody ever heard anything about it. In other words, let us not just do research. Let us create a plan for others to receive our findings, and let us execute on policies and programs on behalf of children, because that is what creates change. And that's why I am so glad that ICHAD and SMART are there, because you know that the research you do is meant to have positive effects on the ground, and translating that is not something every researcher knows how to do. So Grace understood the world beyond where she lives. She understood the historical legacy of child labor and how it came to exist in the United States. For instance, children were seen as persons to be trained for the workforce, and machines were right-sized to fit their human frames. While the fight to end child labor was happening in the United States, Europe was making its way to occupy Africa, with many African nations gaining independence not until the 60s. It is not surprising that the road to end child labor will take some time in Sub-Saharan Africa. I think Grace would guide us in this way. Oops. First, she would say, listen to the stories of the children like Mari Namiremba from Uganda, who was a former child laborer working on tea plantations. She would say, be in direct contact with the child labor, former child laborers, the unions working to protect them, the communities on the ground. Third, she would urge us to stop history from repeating itself. She'd tell every nation and all peoples to protect their natural resources for the benefit of their own development, not that of others, whether it's some other country or some wealthy cooperation. And for Africa, this means the tin, tantalum, gold, cocoa, vanilla. We could go on and on about the natural resources you all possess. Next, she would tell us to equip ourselves with practical tools that we could use right now. We should know about the projects that are being funded, this major regional project by the Netherlands being implemented by the International Labor Organization, focusing on child labor in the production of cacao, coffee, cotton, gold, and tea. She would tell us to learn about all the tools, or the policies also that are out there. And I'm not going to be able to cover all of this in this short time, but the Trade and Development Act of 2000, the Africa Growth Opportunity Act, the Trade Facilitation Act, where Africa is taking trade. So what I'd like to do, and I think you all perhaps have downloaded the app, and I won't go through it fully, but is introduce you to the Department of Labor's Sweat and Toil app. It includes 1,000 pages of research on child labor that lays out the policies, programs, legislation, everything needed. Maybe not everything, but the foundation needed to work with governments to end child labor. So what I've done here is giving you a screenshot of my phone. I was like, of my phone, and I've taken the example of Uganda. So on here is about 140 countries. As you scroll through, I'm gonna just try to do this with you all so I don't miss anything. You'll have the home screen, and you can touch countries. Once you touch countries, you will see a listing. You can scroll up and down on the listing of the countries. I've chosen Uganda. And when you choose Uganda, you will see the goods made out of child labor or forced labor, an overview of what has happened in Uganda over the last year, and then suggested actions that the US Department of Labor gives for a country to advance their efforts against child labor. This includes legal frameworks, enforcement. You'll see the list of enforcement is quite long. Coordination, government policies, and social programs. And I'd be really interested to know from the research you all are doing, how much of these social programs you're already working on. Because I think anytime you work on child poverty, you will always touch upon issues of child labor. And if it's too hard for you to go through the app, the Department of Labor also has the full PDF online. So what else would Grace say? I think Grace would say, don't forget to tell them about the statistical tools that the International Labor Organization has to measure child labor. This would include the ICLS resolution on child labor statistics, the recommendations on how to measure forced labor, survey methodologies on actually how to reach our intended populations, and how to analyze data. Finally, she would also have done her homework, and she would have known that all of these national representative data sets collected by our own countries exist in publicly available form for you to have a field day with. And in doing this, she would urge you all to do a deeper dive of the national statistics already collected on child labor in your countries, review the risk and protective factors associated with child labor, and conduct causal research on interventions that prevent or withdraw children from hazardous work. I mean, one of the key research gaps still today is what impact does child labor have on the physical and mental health of a child? So I know that's very technical, but here's the thing. Grace Abbott wasn't just a founder. She wasn't just an implementer or an inspiration. She was an example of a masterful applied social science researcher. She wanted to bring the statistics when needed, but also do qualitative research. And for those of you who want to read more about Grace Abbott or maybe do a reading club, I would be happy to do that. But I think it speaks to, she was, she didn't just have skills and research method, she wanted to find a remedy for children. So this research to action was so important to her, and it's very important to us, as you know. So these are some surveys, you'll see ones that have been done in Uganda, Kenya, Ghana, and then you'll see here, South Africa wasn't done since 1999. And you can ask questions about why some countries choose to do national child labor surveys on a recurrent and a basis versus those who don't. So I don't know if Grace would put things in this way, but the example of her life leads me to believe that Grace was not only her name, but her spirit. And with that in mind, I want to conclude my time with you, not with my own words, but yet words from Grace. She said this: "Injustice and cruelty to children are as old as the world. We have made some progress. We see things more clearly now than in the past. And with clearer vision, we can do more, go farther. Without apology then, I ask you to use courageously your intelligence, your strength, and your goodwill towards children in the progressive removal of the economic barriers which have retarded the full development of children in the past. There will, I warn you, be discouragements and disappointments, but the cause of children must always triumph ultimately. Perhaps you may ask, does the road lead uphill all the way? And I must answer, yes, to the very end. But if I offer you a long, hard struggle, I can also promise you great rewards, justice for all children. Thank you. So I'm looking forward to having and being in discussion with you all.
So we want to thank you so much, Dr. Castro. I think that's the reason we invited you. So you never disappoint, frankly. So you make it so conversational and easy to understand, yet it is extremely impactful to each one of us. So thank you so much for staying true to these issues and making it user-friendly to all of us and our ability to follow. So I'll pass this to Janet to help us navigate the chat and whether there are people who have questions. I'm sure there will be people with questions. So Janet, back to you, please. So you can help us navigate and kind of help us understand what happens next. But I'm sure that there are people with questions. I may have my own, but I don't want to dominate. How to get to you. I'll let others take this chance. Thank you again.
Thank you.
I'll be happy to moderate any questions as they come in, Dr. Fred. But I think right now, while people are formulating their questions and typing them in, if you want to start with your questions for Dr. Castro, I think that would be a good way to get everyone warmed up and going. So feel free to ask your questions. Dr. Fred.
Yeah, I think I'll give others a chance though, because
okay.
I tend to speak too much. And sometimes yeah. So I'll let others frankly jump in and ask questions.
Great. Yeah, I wonder if anybody has been playing around with the app. It's very interesting. Just my own quick experience is just looking at the products that I enjoy and understanding that there's a huge price involved in all the things we love.
So, you know, since ICHAD's work is around issues of poverty, and you know, when you think about, could you elaborate more? What's the difference between the child labor? How would you define child labor that goes on in Sub-Saharan Africa compared to labor that goes on in Hollywood? So, I mean, could you distinguish so that people, you know, when I'm talking to Sub-Saharan African people, they always challenge me and say there's child labor everywhere. So it would be good. I'm sure, I know the definition, but I'm sure that there are some people who are really perturbed because in much of Sub-Saharan Africa, you have these young people who go to gardens with their parents and they're pulled out of school and sometimes it's not for sale. But you also have those who work in, you know, in for-profit, in coffee plantations and palm trees and all that. So could you help us balance that?
Sure. So no, Dr. Fred, that's a great question. And I think one of the most important things to remember in this is that it's not one country dictating to another country that you have child labor or your situation is worse than ours. And that's why we have international standards. The body of the International Labor Organization is such that government organizations, employers, and workers all come together to agree on standards and definitions. So I'm not going to repeat the definition. However, it is universal in terms of the worst forms, right? So when we talk about the worst forms, children in armed conflict, children in prostitution, illicit activity. So there's no argument there. What the convention allows for is that each government should set their own definitions as to what is hazardous. So there are pros and cons to this. The pros are you allow the definitions of child labor to rest in a national context. And usually you will find these in hazardous work order lists where the government themselves have set out what's hazardous. And this is where the policy debate happens. And this is why, you know, my research and dissertation had focused on how do you define hazardous work in an objective way? Because research shows that children who are using tools have a greater odds of injury than children who don't. And you will largely find that in agriculture. And so the definition of child labor doesn't distinguish whether it's for profit or not for profit, formal or informal sector. It's really what is hazardous to the child and what work prevents them from going to school, and is the work below a minimum working age.
There's someone here, Julia is asking, could you tell us a bit about the work that you do in eliminating child labor, Dr. Castro?
To share about my work? Is that the question?
Yeah, that's in the chat room. I'm looking at the chat. So
Okay.
there are
Okay.
questions. There's
No,
one.
I'm happy to.
Yeah, there's one which says, please feel free to join. Oh, no, that's not a question. So could you tell us a bit about the work that you do in eliminating child labor, Dr. Castro? Yeah.
Yeah, no, thank you. And I think, for social workers who want to get into this field, there are many ways to do this work, from doing implementation work through NGOs on the ground, with international organizations, whether it's the ILO, UNICEF, World Vision, or policy work. So through whether you're a donor, like for a long time, I managed US government grants that were competed for other countries, but I also conducted and oversaw congressionally mandated research. So I had a team about 25 researchers, and they're trained in different fields. They're come from public health, political science, but they had a research and critical mindset, how to analyze laws. So they wrote reports. And I also, I guess, worked in what we call multilateral fora. So this is working in spaces where there are international agencies like the United Nations, negotiating documents related to how do you measure child labor, how do you measure forced labor, how do you create international agreements? And now I'm working at a trade agency, and our role is to negotiate and enforce the labor standards in trade agreements, which include child labor and forced labor.
Great. We have another question from Betsy. In terms of the app, can you see what part of the world people are accessing this information from?
I don't believe so. And now I am no longer at the US Department of Labor, so I am more a user and a fan of the app rather than someone who's overseeing it. So I'm not sure.
And I was wondering, a couple points. You showed that hopeful chart of where there's improvement happening over time. Can you speak to any specific factors that are contributing to that improvement?
I think the improvement really boils down to, well, you have the economics of a country, but where a lot of change is happening is because of political will, because governments are making efforts and realizing that their future rests in these children and a future workforce. And if they're not getting the needed skills for today, will they be able to fill the jobs for the future?
And then another question, what do you know about how the pandemic has affected child labor?
So that's a great question, Laura. I think, there have been several panels on it. Our field has also produced a Nobel Peace Prize laureate, Kailash Satyarthi, and he's led conversations on it with other world leaders. And basically, it seems like it is increasing child labor when, you're not going to school, or parents are even getting sick, and children are having to take the workload. I think, in some ways, I don't know yet, research will come to show if there are parallels from the past where heads of households were dying of HIV/AIDS, which led then to children to work. And so what happens if your parents, your caretakers are falling ill to COVID, and children are having to fill that role? But I think it's really a hard and weird time to say that folks should do research on this because it requires to be out in the field to do research. So I think a lot of it is more anecdotal evidence right now.
Thank you. And one more thought. What can we do? You know, we're not in your position with your education and experience. So what can we, meaning I'll say just for me, I don't have a social work background actually. And what can I do just in my day-to-day? I know being conscious of the types of products we buy, what else is there for us to have an impact?
Sure. So I'm going to answer your question, and then I'm going to speak directly to administrators, professors in the social work community. So I think, what can everyday citizens do? What can consumers do? One, you can raise awareness. You know, you can educate yourself through learning more about this issue, but also asking. You know, I think the more you ask questions to the companies where you buy products from, or even those that are being certified, how they know that it's truly made out of it's not made out of child labor or forced labor, even just puts folks on notice. You can donate to organizations working to eliminate, you know, child labor. The other thing that I want to say is, I think that social work schools, because this history was not told, because the way that the history is told about child labor in the United States is that it's over. Those who are teaching international curriculums, I would like to see this being taught. I think when you think about this history of the social work professions, even those who, you know, in the 1800s, they were concerned about worker rights. They were concerned about the freedom to associate and collectively bargain. That labor history, I feel like, really should be taught at social work schools, because one of the things I think that's preventing our field, or I don't want to say just the field of social work, but the elimination of child labor, is that we do need more professionals out there. We need more professionals who know what child labor is, how to treat children. You know, I think when you think about direct service, these children are not getting the services they need. And then we need to train more social workers on how to be policy practitioners as well.
Thank you. We have a question from Ozge. Government efforts are, of course, critical in addressing child labor. What would you say are the types of most successful, promising interventions at the community level?
Sure. I mean, I think that, you know, there are government programs that get translated to the community level. So some of the programs that have been looked at in terms of eliminating child labor have been, you know, Brazil's Bolsa Escola, Mexico's Progressive program. These are conditional cash transfer programs that give parents money to help send children to school so they don't go to work. The Philippines tried it out in their country. And, you know, it's interesting. So these governments working together to learn how to eliminate child labor. The Philippines tried this out in their country. And when they didn't get the results that they saw, they brought in the government of Brazil and the government of Mexico and other policy and research practitioners to help them. And what they found was the amount of the stipends, the transfers that they weren't giving, or that they were giving to families, wasn't enough to offset the cost of child labor. If anything, early results said it increased child labor because it increased school attendance, but it increased child labor because children then wanted to go to school, but they needed to make sure that they had money for their uniforms and supplies, so they went to school so that they went to work so that they could pay for school. So there are unintended effects, but this is why you have these impact evaluations that you have to work through. And so I think it would be great to see ICHAD and Smart Africa Center take the work that they've been doing through health savings accounts, education savings accounts, and target it to the child labor space, because you're already doing that. You touch some of these populations, but how wonderful would it be to ask the direct research question: do education savings accounts reduce the prevalence of child labor? You know, and I think there are different funding mechanisms for those things too. So I know, you know, we'll continue to be in conversation with each other on how to move this work forward.
And we just have a few more minutes, so if you have a question, please post it in the chat box. You know, I noticed in the app, and I'm sorry, I'm focusing on that app.
No,
it's really fascinating. So a lot of countries aren't there, and you know, like the United States. But I can't imagine that means there's no child labor problems, you know, here or in other countries that aren't on the list. Can you talk about that? What the issues are in the U.S.? I mean, I'm sure we have them. So why aren't they represented in the app? And then what are they specifically?
Yeah, very, very quick eye, Laura. That was really great. So the countries that are represented in the app are twofold. So one, the U.S. Department of Labor does an annual worst forms of child labor report, which is mandated by the Trade and Development Act of 2000. So these are countries that get unilateral trade benefits from the United States. And one of the conditions is to make sure that they are taking steps to eliminate child labor. So there's about, I think, 143 countries that are part of the Generalized Systems of Preference program. The other countries come out of Department of Labor's research that's part of the mandate at the Trafficking Victims Protection Reauthorization Act that mandates them to research countries where they feel like child labor or forced labor is involved in the production of particular goods. So because these mandates are part of the international laws or acts that are given to the Bureau of International Affairs. I'm sorry, they're US laws, but the mandate for the Bureau of International Affairs is international. And so there's another office that deals with child labor domestically, and that's the U.S. Department of Labor's Wage and Hour Division, and they enforce the Fair Labor Standards Act. So if you ask about what are the issues happening in the U.S., whenever we get called to the floor for the International Labor Organization, there are observations against the U.S. about our laws relating to children in agriculture and paid work, and then of course, which will include like migrant farm worker children. So that, I mean, just very directly, the reason that the US is not in that app is because of the mandates, but in the full report of the Department of Labor, they do a section on the US. So yeah.
Thank you. We just have a few more minutes. Dr. Fred, do you have any more comments or questions for our guest before maybe we give Dr. Castro a chance to maybe close us out with some parting thoughts, closing thoughts?
No, I think I just want again to repeat what I said, that thank you so much for doing this. We are extremely grateful. We want to thank the Open Classroom for allowing us to partner. And we have another presentation coming up in October by a colleague of ours from Columbia University, John Santari. And then we'll have another presentation in November, and then hopefully one in December, and then next year. So, but we couldn't have asked for a better person to launch this and get us. Thank you so much for always being there. And thanks to Open Classroom for allowing us to partner. So thank you so much. back to you. I don't know whether Janet wants to say something before we pass this back to Dr. Castro.
Dr. Castro, just if you have any closing thought that you'd like to offer as our time is coming to an end.
I think the only closing thought that I will share is that social workers can show up anywhere. It's about an ethos of taking care of one another. And so I think that I look forward to seeing more of you in the policy space, in the program space, in the research space, any space that will work to end child labor. So thank you very much for this opportunity. And I look forward to continuing our discussion. Thank you.
Well, thank you for your passion and your example. I have no doubt that you have inspired people to take further action and be more mindful. So I appreciate that very much. And want to thank Laura and Dr. Fred. Open Classroom is delighted to have this partnership with you. And we're looking forward to our event in October. And with that, we are at time. Thank you so much to our audience for good questions and being with us. Please stay healthy and safe out there, everyone. Be well.
Bye.